Hello, 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 YouTube world. It's Miss Patty with For Your CNA, and we are here for our live CNA game show where I'm going to go over 15 test-like questions. This is kind of like a practice test, and you guys get to put your answers in the chat and compete for real prizes. Today's episode is actually sponsored, and I'm super excited about my partnership with CaresLink. So it's CaresLink.com. I'll put it in the chat. So hold on, I forgot to do that. So let me put that in the chat for you. CaresLink.com. If you have a chance, go over and check them out. They are a one-stop shop. It allows employers, employees, and educational providers to all connect in one place, and it's specific for healthcare. So that's all it does is healthcare. So on this platform, you can create your own profile and upload all of your documentation, your CPR BLS, your first aid. If you have your dementia certification, all of that can be uploaded so your profile is complete, and then it's one click application to any job that's posted on there. And if you feel like you're missing a couple of certificates, you can actually get the training right on the platform. Super cool. It's a great idea to bring together all three of these separate modalities into one place to make it much easier for employers to find the employees that they need to fill the positions, for employees to get the certifications that they need, and for all of that to happen very seamlessly and very easy. And I'm really, really excited to be partnering with them. So today is brought to you by CaresLink. All right, so let's get into our game show. So hi to everybody that's here. Hello, hi Ash, hi Maddie, hi Shrek Bob, Kia, Blue, hey, Danica, Michelle, TRG, first time getting on a live, so excited to have you here. Blue, no, unfortunately, the puppies are outside with their daddy today, and they're out doing daddy stuff outside, so I don't have the puppies today. But I'll try to bring them on a future episode. Jet is getting so big, it's hard for me to pick him up now. He's so big. All right, so what is today's topic? Let's jump right in. Today, I'm going to focus on questions that you're expecting to be on the CNA state exam. Most people, when they think about the written test, they kind of have an idea of the types of questions that they're going to be asked. And if you've listened to me at all, you know it's not about body systems and terminology and all those things that you tend to focus your studying on. That's not what the test is going to be about. But a lot of people kind of get narrowed in on this topic right here. This is the test plan. So if you haven't heard me talk about the test plan, the master organization that oversees CNA testing nationwide developed this test plan, and it goes over all of the topics that should be covered on any state's written exam. So all of the testing agencies have adopted this, so they all have a version of this. Now every state might be a little bit different in the percentage of each category that is tested. But our state, Florida, is a Prometric state, and all Prometric written test follows this exact test plan. So this is section 3. This is promotion of function and health of residents. And this is going to focus on feeding, bathing, grooming, all of those skills that we're learning in CNA class. What we call personal skills, okay? And this is kind of what we think about when we're thinking about the written test. These are kind of the questions we're expecting to be on the written test. Now, this category, look at everything that's on this category, everything that is covered inside this category. So it's not just the skills, it's on health maintenance and restoration, including nutrition, hydration, sleep, mobility, immobility, but it also is going to cover age related changes. Now, we went over that in a previous episode pretty recently. And psychosocial needs of residents. We have to remember we're not just caring for the body, we're caring for the patient. That means there's going to be some psychosocial implications there. So when you're looking at this whole big list, it can really get overwhelming pretty quickly. Now, this is only 20% of the test, like 1/5 of the test is going to come from this category, and there's a lot of content on this category. So, what are the things that they might ask out of this category? And this is this is kind of where most students focus their time and attention because it is so broad, right? Now remember, there's 4 other categories that can have questions, and one of them is way bigger than this one actually. But this is kind of where we think about. And I don't focus on this category too much because I'm teaching about it in my classes all the time. And I just don't really think to bring it up because I'm going over it so often. So for me, this is my bread and butter. But for some of you who aren't in my class and not watching the live stream, this is going to be really relevant to you because you're thinking, okay, well, this is an important topic. This is the one I think they're going to ask me questions on, but what kind of questions might I see in this category? Now, I do want to caution you guys just a little bit. Now, I'm not bashing anybody by any means, but in one of the Facebook groups I'm in, somebody just posted this yesterday. They were on a practice test website that's very, very common, very well used for CNAs. And, oh, can you guys hear me? I just realized I don't have my mic in the right place. Okay, hopefully you guys could hear me. So one of the, is that better? If that's better, give me a thumbs up. One of the questions that was on this website was you're assigned to give 2 ounces of a medication. How much medication are you going to draw up? And the right answer was actually marked as 59.15 was what the website said the right answer was. And this person posted this question in the Facebook group and said, you know, why is this the right answer? And so I jumped in and said, okay, first of all, that's not going to be a test question for CNAs. Medication administration is not the function of a CNA. So that question shouldn't even be on a CNA practice test anywhere. You have to have additional training to assist with medications, not administer, but assist with medications. So that's not even going to be anywhere near your CNA written exam. So first of all, it shouldn't have even been on the website. But the second part of it is they actually had the wrong answer flagged as the right answer. And it caused a lot of confusion for this student, right? They answered it the way they thought it should be answered according to all the textbooks and all the online research, but the program said it was wrong. So you have to kind of be careful about the programs and the websites you go to and the apps that you use for practice questions, because they may not be the right scope. They may not have the right answer selected as the right answer. And this can really derail you when you're studying for the test because you don't know, were you wrong or was the site wrong? And if you don't really have a good way of verifying, it can lead you in the wrong direction. It'll also have you studying things that you don't need to be studying that are outside of your scope of practice. So just a little food for thought. Be careful about the sites that you're using because they really can lead you in the wrong direction, and then you're studying things that don't have any bearing on what you really need to know. Okay? So I hope, yeah, always question. You're absolutely right. Don't trust anything. Don't even trust me, guys. Um, verify, okay? Because people can make mistakes. They can. I give out free worksheets on my website and in my class. So I have a free worksheet I give out for every single class that I teach. And I've had students that actually let me know, hey, this is wrong on the worksheet. Because sometimes if I'm creating a worksheet and I put the little answer key there, sometimes I can get interrupted while I'm doing that, or my mind is on something else, or my fingers hit the B when it should have hit the C. You know, these things can happen. It can happen in an online course. It can happen in an app, a website. Things can happen. So make sure you have a trusted individual that you can go to and say, hey, is this right? And if you find anything on mine, let me know, because I'm always striving for excellence. And if I've missed it, and sometimes I do, I rely on you to help me find my own mistakes so that they can be corrected. All right, so this is the topic that we're going to focus on today. And the way this works is that each question is going to be displayed for 60 seconds on the screen. I'm going to read you the question and the answer choices. You are going to put into the chat numbers. You're going to put number 1, 2, 3, or 4. No words, nothing else, just one number. 1, 2, 3, or 4, hit send. Fastest answer, most points. So you want to be quick about it, right? Fastest answer, most points. But if you change your mind, it's not going to accept a second answer. So fastest answer is good, but make sure it's the right answer if you want those points, because you can't change your mind after you have submitted an answer. So my computer program reads this in the order that YouTube receives it. So you might see a different order on your screen. Please bear in mind your stuff shows up immediately on your screen. It may have a slight delay getting into YouTube. So my program sits on top of YouTube, reads the answers as they come in, and awards points. My program is the final authority. The top 3 people at the end of the game show will show you the leaderboard. The top 3 places are going to get prizes. First place will get a t-shirt. This is our class shirt. This is what I'm wearing now. So here you can see our class logo. And on the back, we call it our cheat shirt, because the back of it has all of my principles and all of my remember this stuff for the test, right? So everything that you need to pass the test is actually right on this shirt. And you can win this shirt. It's called our class shirt or our cheat shirt. But we have some others if that doesn't ring your bell. So in addition to our class shirt, we have Become Inspire Care with CNA outlined. We have Called to Care, which we call our pink heart shirt. And we have the CNA Care Crew. So if you win first place, you're going to tell me which t-shirt you want and what size. Now, we only ship prizes out to the United States. I'm not set up to ship internationally at this time. I'm so sorry, but international rules right now are just crazy, and I can't keep up with the changes. So we're not shipping internationally. So second place, let me go here. So many buttons to push. Second place is our card game. This is the CNA Principles card game. This is a really fun game to play. There's a lot of strategy involved in it. But you're going to collect the principles. There's some specialty cards that are designed to trip you up along the way. So that's where that strategy is going to come in. You can play this with other healthcare workers, but you don't have to. This game can be played with people that have nothing to do with healthcare, and they're going to play using colors and numbers. It's kind of like a rummy style game. It's a lot of fun. And then third place is going to get some motivational gifts, including our badge holder. And the only way to get this badge holder, guys, as a student or as a CNA, is to win it. Now, I do give some of these away to instructors now and then, but as a student, you have to win this. It is truly a badge of honor. And I actually had somebody not too long ago that won this, showed their employer, and actually got a raise because of it. How cool is that? And then we have some bracelets and keychains and motivational gifts just to thank you for your contribution to healthcare. So that is third place. So some really cool prizes for you. All right, are we ready to get started? Donna says, good morning, Miss Patty. With the help of your program, I successfully, with my exam, you teach me so much. God bless you. Congratulations, Donna. We're so proud of you. Welcome to healthcare. And thanks for coming back to let us know. Hey, guys, this is amazing to me. We just hit 154,000 subscribers and 40 million views. And that's mind-boggling to me. Thank you guys. Thank you guys for coming here and hanging out with me. You have no idea. This makes my day. You are so totally awesome. Thank you. All right, so let's get started with today's practice test game show. So we're going to get started in about 25 seconds. Limber up those fingers. Get yourself in a place that you can quickly respond to the questions. I'm going to read the question and the answer choices. You'll have 45 seconds to be able to input your answer. 60 seconds from the time the question shows up to input your answer, but the quickest answer wins the most points. Here we go. Question 1. When assisting a resident with a meal, the CNA should, 1, only offer food if the resident requests it. 2, insist the resident use proper utensils. 3, ensure the resident is sitting upright. Or 4, make sure they eat all of their vegetables. So when assisting a resident with a meal, the CNA should, 1, only offer food if the resident asks for it. 2, insist the resident use proper utensils. 3, ensure the resident is sitting upright. Or 4, make sure they eat all of their vegetables. What do we want to do here? Go ahead and lock in your final answer. You've got about 10 seconds left. The right answer is, drum roll please. I know this is an easy question, isn't it? Start you easy. Yeah, we're going to make sure they're sitting upright. Absolutely. This is a safety question. We think it's about feeding, but it's actually a safety question. Only offer food if the resident asks for it. Don't do that because that can result in malnutrition. Your patient might be a little afraid to ask for food or may not have a good appetite. We don't insist that residents use proper utensils. That's not our job. These are not children. These are adults. We don't insist on anything. And we don't make sure they eat all vegetables. Sure, we can encourage somebody to eat properly for nutrition, but we can't make sure of anything in healthcare. Remember, they're adults. So Russ came in first on that one, followed by Ash, Maddie, Michelle, and Helen. Great job. Moving on to question number 2. When dressing a resident with a weak arm, the CNA should, 1, ask the patient what they prefer. 2, dress the weaker arm first. 3, dress the arm closest to you first. Or 4, alternate dressing each side first. So when dressing a resident with a weak arm, the CNA should, 1, ask the patient what they prefer. 2, dress the weaker arm first. 3, dress the arm closest to you first. Or 4, alternate dressing each side first. So go ahead and lock in your final answer. You got about 15 seconds left. I thought this question was going to be harder for you guys. I thought I was going to trip you. Look how good you are. You are amazing. Great job, guys. You're impressing me. The right answer here is, yeah, you guys all got this one right. Dress the weaker arm first. And the way we remember this is undress strong arm first, or USA first. Undress strong arm first. And then we're going to dress the weaker arm first. Now, we do want to ask what they prefer as far as clothing, but not how we dress them. We don't dress the closest arm to us first because that could be the wrong side. But we do need to be standing on the weaker side to dress it. So that's actually kind of a trick answer, depending on how your brain worked. But you guys all overcame that trickiness that I put in there and got the answer right. So great job to you. Maddie came in first, followed by Ash, Russ, Blue, and Helen. You guys are awesome. Look at you go. Question 3. While washing wet body openings like eyes, mouth, or genitals, the CNA should 1. Ensure the water is sudsy for effective cleaning. 2. Use cold water. 3. Wash these areas last. Or 4. Use a clean area of the washcloth for every stroke. What do you guys think? This is a little bit harder, isn't it? When washing wet body openings like eyes, mouth, or genitals, the CNA should 1. Ensure the water is sudsy for effective cleaning. 2. Use cold water. 3. Wash these areas last. Or 4. Use a clean area of the washcloth for every stroke. You guys have all been listening to me, haven't you? You are so cool. I really thought this was going to mess somebody up, and it didn't. All of you guys chose 4. You guys are just amazing. Yeah, we don't, and I actually talked about this in yesterday's class, if you watched. We don't put soap in the basin because we need clean water for rinsing. So 1 is not correct. Using cold water, don't do that. That's not comfortable. 2 is not correct. Washing these areas last, actually we're going to wash them first, not correct. Using a clean area for each stroke is correct. So you guys did a fantastic job. And these are the types of questions that you might see on the state exam as it pertains to promotion of function and health, right? Because this is promoting health. We're keeping them clean. But we have to do it the right way. So Maddie came in first, followed by Ash, Shrek Bob, Jennifer, and Russ. Great job. Question number 4. Catheter care should be performed 1. Every 2 hours. 2. Once a day. 3. After each meal. Or 4. As often as indicated in the care plan. So catheter care should be performed 1. Every 2 hours. 2. Once a day. 3. After each meal. Or 4. As often as indicated in the care plan. So go ahead and lock in your final answer. This one's just a little bit trickier. You've got about 15 seconds left. Go ahead and lock in your final answer. What do you guys think? Now, if you've listened to me at all, this should be very, very easy for you. Yeah, care plan. We follow the care plan, the whole care plan, and nothing but the care plan. In general, catheter care is going to be done once a shift, which wasn't an option on here. Every 2 hours is generally peri-care. Once a day isn't usually enough. And after each meal, there's no need to do catheter care after each meal. However, all of those could be the right answer depending on the needs of the patient, and that's where that care plan comes in. So if you have a question like this on the state exam and one of the answers is as often as indicated in the care plan, that will be the right answer because that's specified for that particular patient. Ash came in first, followed by Maddie, Russ, Gypsy, and R.A. Question 5. A resident complains of dry mouth. The CNA should 1. Offer hard candy. 2. Consult the care plan. 3. Tell the patient to notify the nurse. Or 4. Encourage water intake. What do you guys think? A resident complains of dry mouth. The CNA should 1. Offer hard candy. 2. Consult the care plan. 3. Tell the patient to notify the nurse. Or 4. Encourage water intake. Go ahead and lock in your final answer. I know some of you are going back and reading it and going, no! Yep. Go ahead and lock in your final answer. You got 10 seconds left. This is why we don't rush. All right. The right answer here is Number 2, consult the care plan. Yeah, no, number 1 sounds reasonable, right? Somebody has a dry mouth, piece of hard candy might help. Number 4 sounds reasonable. If they have a dry mouth, they might be getting dehydrated. Encourage water intake. But what if the patient has advanced kidney disease and we have to limit their fluids? What if the patient is a choking risk and can't have hard candy? We don't want the patient to notify the nurse. We need to do that. But before we do that, we probably want to consult the care plan because there might be something on there that tells us exactly what to do with this patient if they complain of a dry mouth. And that's why care plan is always king. Yeah, I did trip some of you up on that one. I'm sorry. Michelle came in first on that one, followed by Candace, Denise, Kristen, and Francois. Good job. Question 6. A gait belt should be applied 1, snugly around the resident's waist. 2, first thing in the morning. 3, only on paralyzed patients. Or 4, if the resident is a fall risk. So a gait belt should be applied 1, snugly around the resident's waist. 2, first thing in the morning. 3, only on paralyzed patients. Or 4, if the resident is a fall risk. Go ahead and lock in your final answers. You've got about 15 seconds left. Go ahead and lock in those final answers. I'm going to explain to you why some of you are wrong. All right, lock in those final answers. The right answer here is number 1. A gait belt should be applied snugly around the resident's waist. Now, some of you put 4, and you think that you're right, because if the resident is a fall risk, we're probably going to need a gait belt. The problem is that is a judgment call. CNAs are not allowed to make judgments. You can't look at the patient, see they're a fall risk, and decide to use the gait belt. You made a decision. That question does not say anything about whether the gait belt is on the care plan or not. You assumed. Be careful on the state exam. On the state exam, the question stands alone. You don't get to add to it. You don't get to take away from it. It is what it is. So what this is asking us is mechanically, we need to put that gait belt on snugly around the patient's waist. Ash came in first, followed by Maddie, Michelle, R.A., and Russ. And it's really easy to add stuff to questions without even realizing it. Question 7. When giving a bed bath, the CNA should, 1, protect the linens from becoming wet. 2, completely undress and uncover the resident before beginning. 3, use only no-rinse cleaning solutions. Or 4, apply lotion to all skin surfaces. So when giving a bed bath, the CNA should, 1, protect the linens from becoming wet. 2, completely undress or uncover the resident before beginning. 3, only use no-rinse cleaning solutions. Or 4, apply lotion to all skin surfaces. So this one has a lot to do with what I just told you about the last question. The question stands alone. Don't add to it. Don't let your brain trick you. Sometimes our brains do that. The right answer here is number 1. Yeah, protect the linens from being wet. Now, if you watched my lesson yesterday in class, you know that we don't completely undress or uncover patients, right? We want to protect their modesty and their dignity as much as possible. So that's not a good option. Only use no-rinse cleaning solutions. That might be on the care plan, maybe to use no-rinse cleaning solutions, but we don't know what's on the care plan. It's not telling us, so that can't be the right answer. And apply lotion to all skin surfaces. Again, it might be on the care plan. Lotion's a great idea. I had to put some on this morning. I was getting a little dry. But again, we don't get to make decisions, so it doesn't tell us if lotion is indicated, therefore we can't apply it. Maddie came in first, followed by Russ, Ash, Michelle, and Shrek Bob. Good job, guys. Good job. Halfway point. Question number 8. A resident has limited mobility. The CNA should, 1, encourage them to stay in bed. 2, ensure the side rails are up at all times. 3, reposition every 2 hours. Or 4, use restraints to prevent falls. What do you guys think? A resident has limited mobility. The CNA should, 1, encourage them to stay in bed. 2, ensure the side rails are up at all times. 3, reposition every 2 hours. Or 4, use restraints to prevent falls. What do you guys think? Go ahead and lock in your final answers. I'm so proud of you. So proud. You guys have no idea. You're making my heart super full. All right, the right answer here obviously is reposition every 2 hours. Absolutely. Our care plan has to tell us if we're going to encourage them to stay in bed. That's not a call we can make. Side rails are a restraint. They cannot be used without a doctor's order. Our question does not tell us we have a doctor's order. And we don't use restraints to prevent falls. Restraints actually, and side rails and things like that, even encouraging a patient to stay in bed, those all limit their mobility. It restricts their motion. And without mobility, without motion, without exercise, those muscles are going to get weaker and weaker and weaker, and that means that we're actually doing more harm than good. Repositioning the patient restores blood flow, can help with muscle activation, and overall wellness of the patient. That's why that's the right answer. Maddie came in first, followed by Ash, Michelle, Shrek Bob, and Russ. Number 9. The purpose of using pillows for positioning is to 1, promote comfort and proper alignment. 2, restrain the patient for safety. 3, promote immobility. Or 4, ensure the staff appears busy. So this is an easy question. I threw you a super easy one because on the test you're going to have some no-brainer questions. So the purpose of using pillows for positioning is to 1, promote comfort and proper alignment. 2, restrain the patient for safety. 3, promote immobility. Or 4, ensure the staff appears busy. What do you guys want to choose for this? You've got about 5 seconds left. Go ahead and lock in your final answer. Promote comfort and proper alignment is our right answer. Pillows do not restrain patients, and we can't restrain them without a doctor's order anyway. Our question doesn't give us a doctor's order. Promote immobility. We should never be promoting immobility, not our job. And ensuring the staff appears busy. Sometimes it feels like that as a CNA. Sometimes it feels like, oh my gosh, this nurse is just giving me busy work to do. And that's not the case. Nurses don't have time to give you busy work. What they're trying to do is promote the overall well-being of the patient. You just don't have the reason on the other side of that action. So we're going to use pillows to promote comfort and keep them in that proper alignment while they're in that position. So first place came in, or Ash got first place on this one, followed by Maddie, Russ, Helen, and Michelle. Question number 10. Proper hydration can help prevent all of the following except 1, constipation. 2, upper respiratory infections. 3, urinary tract infections. Or 4, electrolyte imbalances. So proper hydration can help prevent all of the following except 1, constipation. 2, upper respiratory infections. 3, urinary tract infections. Or 4, electrolyte imbalances. I know this one's a little bit more technical. This one's a little bit harder. And you will have a few questions like this on the state exam, but usually only 1 or 2. Most questions are going to have to do more with what CNAs do, not what they know. But there are a few questions about what a CNA knows. So let's see how you did. The right answer here is upper respiratory infections. So proper hydration, actually, we have to have enough fluid to keep our feces in a kind of soft, solid state to be able to expel easily. If we don't take in enough fluid, the body actually pulls fluid out of your fecal matter to be able to hydrate enough, and that can lead to constipation. It can also, a lack of fluid can concentrate bacteria and pathogens in the bladder, which can lead to urinary tract infections. And of course, electrolyte imbalances are all part of that as well. Proper hydration really doesn't help prevent upper respiratory infections. Maddie came in first on that one, followed by Ash, R.A., Russ, and Shrek Bob. All right, question number 11. Almost done, guys. An assistive device, such as a walker or a cane, is often used to 1. Promote independence, 2. Generate additional revenue, 3. Replace physical therapy, or 4. Eliminate fall risks. An assistive device, such as a walker or a cane, is often used to 1. Promote independence, 2. Generate additional income or revenue, 3. Replace physical therapy, or 4. Eliminate fall risk. What do you guys think? Go ahead and lock in your final answer. You got 15 seconds. What do you guys think? Now this one's actually a little bit important. So the right answer here is to promote independence. That's why we use assistive devices, to help our patients remain as independent as possible. Now, this does generate additional revenue for somebody, right? Because that cane or that walker has to be purchased, but that's not the reason that we're encouraging the use of that. Canes and walkers do not ever replace physical therapy. That's not what they're there to do. But I want to talk about number 4. Nothing eliminates a fall risk. So if you see that, eliminate fall risk, it is never the right answer, because there's nothing that can truly eliminate any fall risk. It can help reduce fall risk, but cannot eliminate. So keyword there. Ash came in first, followed by Michelle, Russ, Maddie, and Shrek Bob. One word can make the difference between a right and wrong answer. Number 12, to promote healthy sleep, the CNA should 1. Maintain a consistent bedtime routine, 2. Insist the resident remain in bed, 3. Encourage late night snacks, or 4. Apply an adult brief. To promote healthy sleep, the CNA should 1. Maintain a consistent bedtime routine, 2. Insist that the resident remain in bed, 3. Encourage late night snacks, or 4. Apply an adult brief. 15 seconds left. Lock in your final answer. This one might surprise some of you. The right answer here is, most of you guys got this one right, number, drum roll, 1. Yeah, we're going to maintain a consistent bedtime routine. Absolutely. And that's going to vary patient to patient. Some patients will need some quiet wind down time and then PM care, which is usually washing face and hands, brushing teeth, getting changed into nightwear, getting settled into bed, right? That's all PM care. But whatever the patient's preferred ritual is, we really need to maintain that consistency. We don't ever insist that a resident remains in bed. These are adults. We never treat an adult like a child, ever. If an adult wants to get up out of bed, they have the right to get up out of bed. Encouraging late night snacks, that's going to depend on the care plan. And applying adult brief, again, you cannot do that unless it's on the care plan. Yeah. Ash came in first, followed by Maddie, Michelle, Russ, and Shrek Bob. Question number 13. When assisting a new resident with mouth care routines, the CNA should 1. Identify the resident's previous routines, 2. Brush all residents' teeth every morning, 3. Use a fluoride-based toothpaste, or 4. Use a disposable toothbrush. When assisting a new resident with mouth care routines, the CNA should 1, identify the resident's previous routines. 2, brush all residents' teeth every morning. 3, use a fluoride-based toothpaste. Or 4, use a disposable toothbrush. Now, if you listen to the last question, I gave you the answer. So this is to reinforce what we just learned in the last question, actually. That's why I put these two side by side. And it looks like you guys all got it. Good job. Yeah, we're going to identify their routines. When somebody comes into a new facility, we want to try as much as possible. Now, we're in a facility, so things have to kind of run on a schedule, but we want to try wherever possible to maintain that person's routines. You have routines, I have routines, and we're most comfortable when we can maintain those routines. And as a CNA, you can kind of find out what they normally do. You might be brushing patients' teeth, but it doesn't mean you're going to brush all patients' teeth, because some patients can do that themselves. You might be using a fluoride-based toothpaste, maybe, but that depends on the care plan for that patient. Michelle came in first, followed by Shrek Bob, Maddie, R.A., and Quantiana's channel. All right, question number 14. Almost done, guys. An important component of foot care is to 1, observe for any abnormalities. 2, trim the toenails even with the tip of the toe. 3, apply an antifungal cream. Or 4, air out the feet. An important component of foot care is to 1, observe for any abnormalities. 2, trim the toenails even with the tip of the toe. 3, apply antifungal cream. Or 4, air out the feet. What do you guys think? What is an important component of foot care? Go ahead and lock in your final answer. You've got about 10 seconds left. Yeah, you guys are so smart. You really are. You guys are like amazing. So yeah, we're going to observe for abnormalities. That's the whole reason we're there. We're looking for anything that looks funny. Red areas, sores, wounds, toenail issues, fungal infections, whatever the case may be. Is if it looks strange, weird, funny, off, not right, we're going to report it to the nurse. That's the whole reason you're doing foot care. We do not trim toenails. Not a CNA responsibility. Do not do that. We do not apply antifungal cream unless the care plan tells us to. And this question doesn't have anything about an antifungal order on the care plan. And airing out the feet, yeah, it's nice to do, but that's not why we're doing it. Good job. All right, Russ came in first, followed by Maddie, Michelle, Ash, and Candace. Last question. Here we go. When a resident is lying in bed, they should be positioned 1, in the middle of the bed, 2, close to the wall with the side rails up, 3, on their back at all times, or 4, with a pillow under or between their knees. So when a resident is lying in bed, they should be positioned 1, in the middle of the bed, 2, close to the wall with the side rails up, 3, on their back at all times, or 4, with a pillow under or between their knees. You got about 20 seconds left. Go ahead and lock in your final answer. You are right, Shrek Bob. Yesterday's class went over this. Yep. 5 seconds left. Go ahead and lock in your final answer. Yeah, in the middle of the bed, that's a safe zone. Patients should never be near the edge of the bed. They should not be close to the wall. We cannot rely on side rails to keep our patients safe. On their back at all times, that would be part of the care plan. We would only leave them on their back if the care plan told us to. A pillow under or between their knees. Again, what did the care plan tell us? Okay, so we can't assume, you can't pull things into this question that don't belong there because they change patient to patient. So in the middle of the bed is the right answer here because that's universal. It applies to everybody. Everybody should always be in the middle of the bed. You too. That's how we stay safe. Russ came in first on that question, followed by Michelle, Shrek Bob, Maddie, and Ash. So let's see how we did overall. Let's see who's going to get our prizes. Maddie came in first, followed by Ash in second place and Russ in third. So congratulations to our winners. Great job. So let me go back over here to our prizes. And Maddie, you get to choose your t-shirt. You can get a class shirt, Become Inspire Care, the Pink Heart shirt, or CNA Care Crew. So you're going to send us your selection, let me put this in here, to our email for your CNA at gmail.com. You are going to tell us your screen name, your real name, your address, because we have to mail it to you, and what place you came in. First place, I also need to know your size and which t-shirt you want. Second place is going to get our card game, and third place will get the badge holder and motivational gifts. So hopefully, hopefully you guys had some fun today and learned a few things about what to expect on the state exam. So these are the kind of questions that most people kind of expect to show up on the exam. And you're right, this will make up about 20% of the test. The other 80% is going to come from other topics. And if you want to know more about those, go watch some of our previous episodes or tune in on the first and third Tuesday of every month at 11 a.m. Eastern, where we'll go over another 15 questions based on the testing care plan. And I hope you come back and join us. And to all of you guys that made it possible for us to hit 40 million views, do you guys know how much time that is that you've invested in us? It's amazing. We are so thankful for you. And 154,000 subscribers, that's just beyond my wildest dreams. So thank you for all of that. If you have a chance, go check out CaresLink, careslink.com, careslink.com. Create your profile. You never know. You might actually see a position that you're interested in applying for, and then you can do that with one single click. On that same website, there's some activities there that can help improve your interview skills. So really cool stuff on there. It's all for free. So go check it out, careslink.com. We would appreciate it. So I hope that you guys had fun today. I hope you learned a few things, and I hope you have a greater level of confidence going into the test or into your practice. Because remember, it's not all about the test, is it? We have to remember that the test is just our gateway to be able to work with patients. So if we remember these principles as we're going through our daily work, as we're working with patients, we will be stellar CNAs. So thank you guys so much for joining us, and I hope to see you tomorrow for Class 4. We're going to go over test registration along with some other topics, and I'll see you on the next game show the first Tuesday in November. Until next time, happy caregiving. Bye.